Good morning, everybody. I cannot thank you enough for joining us here this morning. Taking time out of your busy schedule to be here with us is meaningful and is very much appreciated. I want to wish you all a happy November. November 1st. It's hard to believe that it's already here. We survived Halloween. I'm sure you felt the ramifications of that yesterday in your schools and probably again today with some candy hangovers. But we are so glad that you're with us to hear this Beacon overview with Dr. Dana Weiner. No one here has a deeper understanding of the frustration felt by families seeking mental health and behavioral health services for children in crisis than you do. You know how a lack of coordination and communication between agencies combined with difficult to navigate systems can delay a child's access to vital resources and services. Yet through it all, you continue to serve as advocates and strong supporters of your students and their families. If you weren't aware, Governor J.B. Pritzker launched the Children's Behavioral Health Transformation Initiative in February of 2022. And there's been a lot of exciting projects coming out of this initiative, all aimed at adjusting capacity, streamlining access, and supporting early intervention to prevent acute crisis for children. One piece of this work is what we're here to discuss today. It's called Beacon. And you all, as school social workers, school counselors, and special education administrators, are being invited to be early users of this portal before it launches to the public in early 2025. This new state-of-the-art online portal powered by Google AI is a cloud computing technology. It will play a crucial role in improving how families and providers find and coordinate care. Beacon has the potential to change and save lives. I encourage you, all of you, to use this new tool over the next few months to provide us your feedback directly through the platform's feedback channels. Your input on this is valuable and will help us improve the platform for the better, so we better serve Illinois families and students. Here to tell you about Beacon and how it can help you and your students is one of my favorite people in the world, Dr. Dana Weiner. Dr. Weiner is the Chief Officer for Children's Behavioral Health Transformation, and she's a Senior Policy Fellow for Policy Research at Chapin Hall. Dr. Weiner is an expert in child welfare. She has served for 6 years as a Senior Policy Advisor to the Director of the Illinois Department of Children and Family Services and is the Evaluation Liaison for the Permanency Innovations Initiative. In 2011, she was appointed by then Illinois Governor Pat Quinn to serve on the Illinois Juvenile Justice Commission, and in 2013 was appointed to serve on the Child and Family Services Advisory Council. Not only is she a leader, she is also a teacher. She teaches data for policy analysis and management courses to master's level students at the University of Chicago School of Social Service Administration. She's also taught doctoral level courses, and she has her doctorate, obviously, from Northwestern University. So it is an honor to join Dr. Weiner again here this morning as she gives you an overview of Beacon. Thank you, Dr. Weiner, for all of your time and effort.
Thank you, Superintendent Sanders, and thanks for having me. It's wonderful to be in such a big room today with over 340 of you to talk about the work that we've been doing and to provide you with some information about this new tool that we hope will make things easier for you as you help families navigate finding services for kids with mental and behavioral health challenges. I also just want to echo Superintendent Sanders' gratitude to all of you who are really on the front line. You are the constant in the lives of young people who you see every day. Oftentimes you're the first to notice if something, if there are challenges in a youth's mental and behavioral health, and you're the person that many families go to first when they have questions about this. So I'm hoping that you will find this to be a valuable support and eager to hear from you about it. So as Superintendent Sanders mentioned, I've been working on the Illinois Children's Behavioral Health Transformation Initiative since 2022 as we came out of the pandemic in recognition of our growing youth mental health crisis and diminished workforce. The governor's office requested a comprehensive review of our system for responding to the behavioral health needs of young people, and with a focus on closing gaps in services and making it easier for families to access things that are available to them. That requires a lot of coordination among the 6 child serving agencies in our state. You all represent one of them, that is the Illinois State Board of Education, and you are joined by the Department of Children and Family Services, DCFS, the Department of Human Services, the Illinois Department of Public Health, the Department of Juvenile Justice, and the Department of Healthcare and Family Services. And together, those 6 agencies offer a variety of programs and services, but historically it's been very hard for families to find those programs and to work among them to match kids with the thing that they're eligible for and that they need. So Beacon is going to help us with that. And Beacon is a core component of the Behavioral Health Transformation Initiative. So I'm just going to tell you about a set of priorities that have really been driving this work. And I think you'll see them reflected as we walk through the tool. The first is to simplify the family's experience. So at the center of what we're doing is to try to make it easier for families to get the care that their kids need. And that means absorbing the complexity behind the scenes so that the state is managing all of the complicated eligibility determinations and funding arrangements, and families just see something simple, which is Beacon. The second thing is to speed things up, to improve our efficiency using powerful technology that can automate the things that human beings have been spending a lot of time doing that takes them away from their task of working with families. So things like determining what services someone is eligible for is now happening in an automated way in Beacon. The third priority is listening. So we have really tried to elevate the voices of consumers by engaging parent leadership and youth participation. And that means that the system that you'll see me present today is one whose development was informed by families from the very beginning. We didn't build it and then turn to a group of parents and say, what do you think? We asked, what would you need? What functions do you need the system to do? And that's what you'll see in Beacon. And then the fourth is to continue to promote collaboration between the state agencies, which, as you might know, has not always been easy because each state agency has a different technological platform and there are legal barriers to working together. And I'm happy to say, have overcome many of those to really build a cohesive team across the agencies that can respond to the needs of young people. So I mentioned that a centralized care portal, Beacon, is a key strategy in the blueprint for transformation, which came out of the first year of the initiative. Some of you may have seen the blueprint. If not, happy to provide it to you, or a quick search, you'll be able to see it online. The blueprint has 12 strategies in it. They are listed across the top of this grid. The care portal is Beacon. That's the first of them. And I use this grid to illustrate for everyone that no one of these 12 strategies, even Beacon, is going to solve the problem of getting kids to the services they need faster. We have 5 goals. Superintendent Sanders mentioned 3 of them: adjusting capacity, improving accessibility of services, and giving us the ability to intervene earlier. We also have 2 more goals for our system at large, which are to be more agile and responsive to what the data tells us people need, and to be more accountable and transparent in our interactions with the private providers who deliver a lot of services. But I use this graphic to illustrate that there's no one silver bullet, that we have to do all of these things in order to accomplish our goals. And Beacon is just one piece of this puzzle. Beacon is essentially a routing application. It connects families with people who can help and lets everybody, including the helpers, including all of you, see what is available for young people. There are many other improvements currently underway, including a statewide resource referral tool, which I envision as something that lives on everybody's smartphone. And in my dream, it will be like the open table for community behavioral health services. But we don't have that yet. So for now, we have a placeholder in Beacon that serves that purpose, but isn't quite as dynamic as the tool I'm envisioning that HFS is in the process of procuring. We are also working on building additional capacity so that kids don't wait so long for services. We're working on strengthening community networks, rebuilding what was once pretty robust in the context of the LANs, the local area networks, and we're working on expanding the behavioral health workforce. But Beacon is a key piece of the puzzle. It does not provide a diagnostic assessment. It does not prescribe services or make appointments at this time. What it does do is it makes visible all of the information about state-funded services and programs and community-based programs and services, and gives parents and helpers a single place to go when they need assistance from the state in addressing more complex needs. So why did we start with this tool? Well, Beacon was created to help families find and connect to the right services in one place, instead of staying up all night searching the websites of all of these state agencies that I mentioned. We also created it so that we would be using technology to streamline communication and reduce delays. We could use it to track progress and communicate about the status of requests. And it was really important to create a tool that would allow the state agencies to work together. So a bit of history here. In the spring of 2022, when I began working on this project, we convened a group of interagency representatives. ISB had a representative in that group, and that group still meets every Friday morning. They're meeting now, actually, to talk about expediting services and programs, expediting services and placements for kids who are stuck. So we have a group of kids who are stuck in hospitals for psychiatric reasons, or they're stuck in their parents' home, or maybe they're kids who have an IEP that calls for an alternative educational environment, and we can't find that placement. That group that meets on Friday morning works collaboratively to find the right place for each of those kids. And this is the first time they've been able to legally and technologically work together. We've solved a few of the problems that were standing in the way of that, one being the legal permission, which now is provided by the guardian's consent. And I'll talk more about that. But anyway, the picture in this slide is meant to depict, this is a reflection of what parents told us finding residential services was like. They said that what they get depends on which door they come in. All 5 of these agencies could place a young person in a residential treatment setting, and that it was like navigating a dark, unmarked forest. So we have changed that so that now it looks like this. And no matter which door you come in, you are met with information and a navigator. You see there's a little park ranger there that can help families identify where along the continuum their youth can get help. So Beacon, as I mentioned, is a routing application, meaning it gets people to the right place. It is serving as a centralized service portal, so it's one place to go to find all of the services. The more information that families or that you were to provide about a youth, the better Beacon can match on eligibility criteria to the most appropriate service. But it also allows the state agencies who have consent to work together, share information, and track cases to make sure that families get responsive and timely services. As I mentioned, we worked from the beginning with families to ensure that whatever we built would give them what they needed. And what we heard from parents was, we want a place where we can create an account, where we can upload documents like the IEP, like hospital records, like the psych eval, so that those things can live online in a place. And if a state program or a provider asks me for those, I can say it's in my Beacon account. And now that is what families can do. It also, what Beacon does for families is it gives them the opportunity to work with a resource coordinator and or a clinical specialist and or a navigator. So I'll just explain a bit about that. Beacon is staffed by a team that works at the Division of Mental Health in the Department of Human Services. And that team consists of resource coordinators and clinical specialists. The resource coordinators are like the first line triage people. So every morning they see who's in the queue, what requests have come in, and they start prioritizing those and responding to them. And sometimes that's as simple as making sure that the family has signed a consent form or making sure that they were able to obtain a list of services. Sometimes, if what the youth needs is more complex, they might send the case to a clinical specialist. And we hired 5 clinical specialists, each of them specializes in a different area that we observed in our first 2 years of doing this collaborative work was an important need. So it might be kids with aggressive behavior, or kids with developmental disabilities, or transition age youth, or kids with internalizing problems. Those clinical specialists have specific expertise that can help them help a family to get to services for more complex problems. And then the third option is the resource coordinator might send the youth's information to the interagency team to work together on finding an appropriate placement. But parents can also ask for help from a navigator who can help them understand the process of getting services. So why did we think that Beacon, why do we think Beacon will help improve our system? First, we think it will help increase access to services by making it easier to see what's there. Second, and we have data on this, so we know that it speeds responses because it helps us coordinate care across the state agencies. Third, we believe it will empower families to be more active participants in the care of their young people because it will give them these tools. And fourth, we think it is reducing stress among parents by giving them a much broader view of what is available so that they can choose among services. So a few words on the ethical considerations and where the information lives, and then I'll talk you through how to use Beacon. So, of course, the information being entered into Beacon, if a family chooses to enter use information, is private, and it has to be held securely. And that the data, this information that is entered by families, is handled securely and in compliance with all privacy laws on an encrypted and secure platform that only individuals who have consent can access. Google does not have access to the data that goes into Beacon. Google built the tool, and then when it went live on a platform that is owned by the state. And the people who have access to the data are the people who families consent to. The data live on the platform that is managed by DMH. Families give consent by signing a consent form that has been reviewed by no less than 12 attorneys, 2 from each state agency. And once they sign consent, their information is viewable by the people who are working to match youth with services. So Beacon adheres to all legal standards and mandatory reporting laws. The governor and I, at a press conference in January, announced that Google would build Beacon. And 8 months later, Beacon went live. In its initial rollout, starting on August 15th, it went live only to the representatives from the state agencies that were already working together to expedite services and placements for kids. We gave them about 6 weeks to work out the kinks, and then on October 1st, we began to introduce all of you to Beacon. And this phase 2 launch includes not only school personnel like yourselves, but hospital staff, attorneys, state agency staff, pediatricians, advocates, other groups of people who are helpers, who are working with young people. Once you've all had a couple of months to kick the tires on this tool, we plan to release it in January to the public with a big public awareness push that Beacon is the place to go. The reason for this slow, methodical rollout is because while we're happy with how the technology is working, for the most part, you might find a glitch here or there, and we hope you'll tell us about it. We know that implementing new processes with people takes time and practice, and so we just really wanted to make sure that we could surface and iron out any wrinkles before we roll it out to the public, because we don't want people to be frustrated. We are trying to address their frustration, not exacerbate it. So this is where we are now in the phase 2 launch. And this is Beacon. So this is how you access it. There's the web link. You can create an account. Parents can create an account, or you can help them create an account, or you can use it anonymously. There's plenty of things you can do in Beacon if you don't create an account. The other thing, back to this function as a routing application, is that depending on what the concern is, Beacon may redirect. So if the family or the child are in crisis, it will redirect them, and you'll see in a few slides, it will redirect them to crisis resources. If the youth is actually an adult, it will redirect them to adult services. And if the youth is a young child, it will redirect them to early childhood services. But this is what the login page looks like. And this is how you create an account. So we do recommend that parents or guardians log in and create an account before they get started. It will make using Beacon easier, just like you may create accounts at many of the websites you go to. If your information is already there, it saves you time the next time. It also, in the case of Beacon, allows both the platform and the staff at DMH to more comprehensively identify services that might help with the youth's issues. And you'll be asked a number of questions about this young person, their characteristics, their clinical needs, what the problem is, what they're looking for, if you create an account. If you don't create an account, you can still use Beacon. And this is an example of what you will see. So if you're looking for community-based services, you will be shown this list of options for resource directories. I want to highlight for you that Spider is the tool that is managed and maintained by DCFS through a contract with Northwestern University. And Spider is the most comprehensive, currently, the most comprehensive listing of community-based services for mental health, substance abuse, and even non-clinical things like mentoring and tutoring and recreational programs. You can use Spider even if you don't create an account. The other tools that are listed here, and we did an exhaustive review of every tool that was in place all over the state, and we heard about IRIS and we heard about referral GPS. Some of those tools are proprietary and you can't use them without a license, but the ones that are publicly available and we thought would be helpful, we listed here. But again, some like 211 are only available in some parts of our state. But if you search those programs, you will get, if you search those tools, you will get lists of programs. If you are comfortable sharing information, you will also get a list of the state-funded programs that the youth might be eligible for. That does not enroll them in the program. It just tells you, it gives you information. So I mentioned you can also request additional assistance from the Beacon team if you want more guidance and help to access services. So these slides illustrate for you how you do that. If you click on next step after you get the list and it says, do you need more assistance? You click yes, and then the information is sent to the team of resource coordinators and they will reach out to the family. But as I'll remind you again in a few minutes, if you are doing this on behalf of a youth, you have to remember to tell the family that someone's going to reach out to them. So this is what I was talking about a few minutes ago. If you need crisis help, Beacon is not the place to get crisis help. Our state has a 988 line. Our state also has the CARES line, which can initiate a mobile crisis response, and obviously 911. So if you realize that you're looking for services for the future and you need crisis help now, the crisis help button is at the top of every page, and you can click on crisis help. It will provide this information. So those are the basics of how you would use Beacon, and it's pretty self-explanatory. I think if you go to it, you'll understand the other pathways through it. But I'm going to make this a little bit more concrete and just talk about some examples and some case vignettes before we open it up for questions. So first of all, how will all of you use Beacon? How will this help you? Number one, it can help you identify services for behavioral health needs. So teachers, counselors, social workers can use Beacon to find services for kids who have behavioral health challenges. It can help you connect a family to community-based services or counseling or crisis intervention. And it can help you help families help themselves by directing them to set up an account in Beacon. It can also support your work for kids who do have IEPs, perhaps those who need an alternate educational environment, by helping you connect with the interagency team. Because if there was a youth that you were looking for, like a therapeutic placement, if you entered that case and it went to the interagency team, that team works collaboratively with ISB representatives to help. It can also help you collaborate with families and providers and empower families by helping to track the status of referrals and work closely to ensure that students receive timely support. And this is how parents and guardians can use Beacon. Similarly, they can use Beacon to navigate the service landscape, which can be difficult. They can create a case to get an immediate response. And this is unusual. What we are hearing as feedback from the families who've experienced the Beacon response is that they are not accustomed to having such easy access to a human response when they need services. So these resource coordinators at DMH have been doing a wonderful job following up with people in a timely way, linking them to services. And it can let families track the progress and status of the case that they entered and receive real-time updates and reminders. So as I mentioned, we've been using the precursor to Beacon for 2.5 years, and we've staffed 444 cases. Actually, now we're probably closer to 500 cases if you combine Beacon with the previous portal. So we pulled a few examples from the cases that we've already worked on, just to give you a sense of how Beacon can help. And I'm going to talk you through them. The first one is Amelia, and these names have been changed, of course, along with some key details that we modified so as not to violate anyone's privacy. But these are good examples of how Beacon has helped. So Amelia, a 14-year-old with diagnoses of ADHD, depression, and anxiety, had been hospitalized after a suicide attempt, but had also been implicated in aggression toward a younger sibling in the home. And the hospital social worker entered Amelia's information into the portal to try to help the family find a residential treatment option for after hospital discharge, because her grandparents, who she had been living with, felt they could not take her back home because of concerns about her behavior and risk to her sibling. So prior to entry into Beacon, this family had not connected to any supportive services, but a Beacon clinical specialist worked with the family to enroll Amelia in the Pathways program out of HFS, the Family Support Program, FSP, as well as interim relief, and was able to also arrange to have an IM-CANS assessment done on Amelia. Following all of this connection, the Family Support Program successfully identified a residential placement for Amelia, and she was discharged from the hospital to this placement. So that was one of our resolutions. And then the next one I'll tell you about is Eric. So Eric, sorry, just nosy. So Eric is a 15-year-old with a history of behavioral health challenges and juvenile justice involvement. I don't know if you're familiar with the CCBYS program. That's a program, a wraparound style program operated by DHS and it is for kids who are at risk of juvenile justice or child welfare involvement. And in this case, the CCBYS worker entered the youth's information into Beacon after hearing his mom express that she did not want him to return home, and she was seeking a residential treatment placement for him. But no applications or enrollment had been initiated on the part of this family. So when the CCBYS person entered the case into Beacon, a Beacon resource coordinator promptly responded and worked in partnership with CCBYS, with, sorry for all the acronyms, the CCSO agency that administers Pathways for Success, and worked with the family to enroll this youth in Medicaid and to find a safe place for Eric to reside at a relative's home while they completed the applications for residential treatment. But lo and behold, while the Beacon resource coordinator was able to provide the relative guardian with a list of local services and connect the family to them, they then decided they did not need a residential treatment placement, and they would be able to maintain Eric safely and happily in the community with the support of those services. I am not making this stuff up. These are cases that came from the portal, and there are hundreds more like these where we were able to quickly mobilize an interagency team. Now, as I said in the beginning, Beacon is just one piece of the puzzle. We haven't solved the problem of it, making sure that we have the right capacity for everyone, so there won't always be a spot available. But this system is going a long way toward breaking down some of the barriers and making things faster and easier. So I'm going to give you a few more tips, and then we'll open it up for questions. In order to maximize Beacon's benefit for families, first of all, if you're searching for information on behalf of a family, please make sure to provide them with the entire list of services that they may be eligible for in order to empower them to make those choices. And because we found that we have a short window when people are open to receive services, and we want them to be successful in those early attempts. So giving them a lot of options is going to help that process. Second, if you, I said this earlier, but just to reiterate, if you request additional assistance on behalf of a family, please let them know to expect that a resource coordinator will reach out to them so that they are not surprised or dismayed to learn that somebody has the basic information about their child. Now, that resource coordinator, if you have not helped them submit consent, the resource coordinator will attempt to get consent from them, of course. And then third, remind the family that we need their permission to share any information with the Beacon team. We need their consent. So if the family needs help submitting consent, the Beacon team can assist. The resource coordinator can help with that. But just remind them that only with consent can their information be shared. So just a few words on next steps, and then we'll open it up for questions. we are continuing to add new features and enhancements based on feedback from families, from providers, and from staff like you. So if you find something in this system that isn't working right, please don't throw up your hands and say, oh, this doesn't work. Please email us. There's contact information in Beacon. You'll see all over Beacon. And that goes straight to the portal manager, who also works at DHS and works with us closely. And we compile lists every day of tweaks and improvements that can be made. So please partner with us in making this the best tool it can be. Second, we're continuing to integrate more services into Beacon all the time. Every new thing I learn about when I'm out in the field talking to people, I make sure that we either incorporate it into Spider, if it's a community-based service, or incorporate it into our, what we call our master eligibility algorithm that provides families with service matches. And then just remember that this whole system is continuing to undergo improvements and refinements and updates so that we make sure that we're being responsive to the needs of families. So I think at this point, we can open it up for questions. And I think that Nat is going to facilitate those.
I will indeed. Good morning, everyone. The first question, will this system undermine or overrule the IEP process, particularly in terms of residential treatment? For example, we have situations in which students are making progress in their home school, but parents want residential. Schools are required to follow many rules and regulations related to LRE, FAPE, and ISBE approved programs. How will the processes required by state and federal law for schools be supported?
Excellent question. This is not changing anything about the IEP process. You are absolutely right that that process is governed by rules and laws that we are merely working adjacent to. And if this system can be helpful to kids who have, many of the kids in our system, I actually have data on this because we have a series of dashboards. Many of the kids in our system do have IEPs, but they may require more services outside of school beyond the things that are in the IEP. And to the specific example you gave, parents are entitled to the things through the school district that are detailed in the IEP. And as a parent of a youth who formerly had IEPs for years, I'm very familiar with that process. If families decide they want something else outside of the IEP, they're free to try Beacon and see if their child is eligible for services through other state agencies, but it doesn't change the school's obligation via the IEP and the assessment process. And Superintendent Sanders is nodding along, so I think we are in total agreement on that.
All right, next question. We are currently using Referral GPS. Does this system replace that, or should it be used in addition to?
So thanks for mentioning that. It came up actually on our webinar yesterday too. I'm glad to hear that people are finding Referral GPS to be useful. I think I mentioned early on, one of the things that we did, because I am a big believer in not reinventing the wheel and not taking anything away from people that they find useful. So one of the first things we did was to try to figure out what are people using. And we heard about IRIS, we heard about Referral GPS, we heard about Find Help 211. But what we found is it's different depending on where in the state you are. So we decided that we would put links to the things that were open and non-proprietary into Beacon. And I'm happy to share the kind of master inventory of all the tools if anyone's interested in it. So we put some of those things in Beacon. We did not put Referral GPS in Beacon, not because it's not useful, but because we thought it wouldn't be available to everyone. And if it's working for you, keep using it. But Beacon is a way to get to some other things like access to the interagency team or specific services for kids with complex problems who are maybe coming out of the hospital or something like that. So it's not meant to replace Referral GPS. What I will say is that as HFS works towards procuring what I hope will someday be the open table of outpatient behavioral health services on everyone's smartphone, we may either expand one of the existing platforms to serve that function, or it may eventually be even more useful than the tools you're using. But again, if referral GPS is working for you, please keep using it and use Beacon as another tool in your toolbox.
Okay, next question. Do school personnel access the program anonymously for each kid, even if I'm working with the family?
I would say that if you are working with a family and you have a relationship with them, that setting up an account for them in Beacon will yield a more fruitful experience because it will provide more tailored recommendations. If you are working to help a family and you don't have their cooperation or you don't have a relationship with them to allow you to together access Beacon, then I think it's still useful to you because you can search for services knowing what you know about the family, but anonymously. So I think wherever possible, if you can set up an account, it mobilizes a whole other support team out of DMH, which might be useful to you or the family.
All right, next question. Will Beacon assist students on the autism spectrum and accessing services and evaluations?
So absolutely, and one of the things so working this way, I mentioned we've been using a test portal for 2.5 years. One of the things that has illuminated is some of the gaps, particularly for kids on the autism spectrum who don't meet criteria for developmental disability services. So as a response to that, it shined a light, like this process has illuminated groups of kids who don't have enough service options. As a response to that, and this is a different topic for another day, but I'll just mention it. We are working with DHS to stand up a pilot of in-home behavioral health aides for kids who have autism and don't meet criteria for in-home services based on their intellectual disability. So some of you are aware, and my son was, at one point had a one-on-one aide in school. Kids who have one-on-one aides in school sometimes need that one-on-one attention at home, and we don't have that service for them. So we're trying a pilot of that service. But the short answer to your question is yes, of course, you can use Beacon for kids who have autism.
All right, next question. Does the consent process have multiple tiers? For instance, what if families agree to basic information being shared with Beacon, but they do not want information about disability status or immigration status reported in the system? Is there a way for us to have partial consent?
That is such a good question. Currently, there is not a way to give partial consent, but let me say 2 other things about it. One, the data that go into Beacon are not like the data that go into ISB's iStar system, where they are then a record that follows that youth. The data that go into Beacon sit in an account that the parent holds and is not in a place that it would ever, there's no mechanism for it to follow the young person. So I don't know if the concerns about providing some of that information would be the same, and not all of the information you mentioned is required to be answered in Beacon. As you'll see when you navigate it, some things are required, but many things are not required. So that's number one. But number 2 is not a bad idea. I'll take it back to the team. The negotiation of the consent form was extensive, and in this iteration, we don't have the ability to give provisional consent or to edit it, but I can explore whether that would be possible in the future.
Okay, next question. Does a child insurance limit or affect this process of receiving help from the Beacon staff?
So what I will say about that is no, people with private insurance can use Beacon and they will be responded to in the same way as anybody else. However, if you have private insurance, your insurance company likely has a network of providers, and it is in your best interest to seek services from that network because they will be more generously covered. So what Beacon advises people is when they enter the type of funding they have, if they have private insurance, it does direct them to consult their insurance providers network or care coordination network. Not because Beacon won't serve them, but just because we want to maximize everyone's benefit and not like usurp a function that is served by their insurance company.
Next question. After school personnel makes a referral to an agency, what happens if the caseworker can't reach the family?
Okay, so I think what you mean is the case goes into Beacon and it shows up on the queue of a resource coordinator. And then the resource coordinator tries to reach the family and can't. If that's the scenario you're talking about, there is language on Beacon, and I don't want to get it wrong, but I believe that it says something like, we will make 3 attempts within this period of time to reach you. And if we can't reach you within 3 attempts, we will stop trying to reach you. But then if you want your request to continue, please re-enter it. And that's really for the sake of that team, because the volume, to manage the volume that they're getting, they have to be able to say, okay, we tried X amount of times. But I have to say the feedback I've been getting on the DMH team has been wonderful. Like, they are diligent and persistent, and they really, have been making intensive efforts to reach people. I think that's what you mean. There might be another thing that you mean. If your question is regarding actually making a service linkage to a provider agency, what I will say about that is our current system, Beacon, does not have the ability for you to hand the ball to like a therapy provider and have them say, yes, I got it, I'll reach the family. That's not happening. That will be able to happen in our future system that will live on smartphones, where we'll be able to make what's called a closed loop referral, where you send a referral to a provider and the provider says, yes, I got it, I'll reach out to the family. We don't have that today. We will someday. I like to dream big, but we don't have it today. So I hope I answered one. I hope your question was one of those.
Okay, I'm going to merge 2 questions here. The first being, is the information on the website available in Spanish? And the second question is, are the staff at Beacon multilingual?
Okay, well, I have the answer to that question now, and I should have printed it out, but Beacon is translated into 6 languages. I could tell you what they are, but I have to get up and grab another device. We basically worked, it turns out every state agency and the governor's office has a different top 6 list of languages, but the languages include English, Polish, Spanish, Ukrainian, Mandarin, and I just can't remember what the 6th one is, but I can look at. Oh, Superintendent Sanders is telling us.
I assume it'd be Gujarati, but I'm not. I don't know.
I'm not sure, but I will.
So
the next.
we can check it and send it out.
Yeah. So anyway, so Beacon is translated into 6 languages, and Luisa's telling me what the other one is. Okay, sorry, I got it wrong. These are the languages: Arabic, Spanish, Hindi, Polish, Tagalog, and simplified Chinese. So I was wrong. I was wrong on 2 of them. Those are the languages that Beacon is translated into. The DMH staff do not speak all of those languages, but DHS has an interpretation line so that there is the ability to get information in other languages, but the resource coordinators themselves don't speak all of those languages. So we think we have the other language services covered, at least as it relates to those 6. But we're open to your thoughts and ideas about that.
All right, next question. I used IRIS. Does Beacon provide a wider range of behavioral health options?
Okay, so IRIS is a great tool. I loved it when I previewed it. It is not available everywhere, and it is one of those tools that is proprietary and costs money to use. So we didn't list IRIS in Beacon. However, the analog, like the comparison to IRIS is not so much Beacon as it is Spider. So I would say you could look around in Spider and see if you think the service comprehensiveness is similar. Spider covers the whole state, but I don't know if the frequency of updates in Spider is as often as it is in IRIS. I don't have data on that. So I would encourage you to check it out. But IRIS is a great tool, and they have a very sweet logo that I like a lot.
All right, next question. So we can refer families to use this when they're seeking residential placement on their own. We have students who the IEP team don't feel that a residential placement is warranted for, but the family doesn't agree due to the student's behavior outside of school.
I love talking to ISB audiences. You all are doing such a good job connecting the dots. That is exactly an appropriate use of Beacon. Because if you're working with a family and they want something that isn't covered as an educational support, but they still feel like they need it, Beacon will help figure out if they're eligible for it and how to get it. Yes.
All right, next question. Can Beacon eventually allow for school personnel, school counselors, and social workers to create an account to then provide saved progress or searches to come back to or follow up further on if or when further support is needed for the same student?
I also love this question, and I want you on our team to think through how to do this. So my promise to you is that as we work on the procurement of the statewide resource referral tool that HFS is procuring, and the reason they're doing it and the reason it's taking a little longer is we want to be able to use Medicaid funds to pay for it, because it's going to be a big system that's going to cost a lot of money, and we want to be able to get a match on Medicaid funds. So when we build that, the function you just mentioned is something that I want for sure to be in there, that if a helper, a school personnel, anyone does a search, I want you to be able to save the search, not only for that particular family, but in case you get another case with a very similar situation, you're like, oh, I remember I did this search before, and you want to be able to come back to it. Yes, that system will let you do that. Beacon today is not going to let you do that because the accounts are the parents' accounts.
Okay, next question. What happens once you register a child or family in Beacon? Are they tracked? We have a lot of immigrant families who come from countries where there's a lot of fear about putting names in a government service. How can I help them understand this process and how their information is used?
The Beacon data are only accessible to the interagency team that the family gives consent to and the DMH staff who will reach out to them. And I guess I should say the Chapin Hall team that helped build the system and is working to make sure that it's working. Nobody else has access to this, and it's not connected to any other part of our government. Now, there are people who said, hey, it would be great if people could enroll in benefits through Beacon, could we hook it up to that system? But we haven't done that. We may do that for the sake of helping people, again, get routed to the right place. But the Beacon information is not connected to anything else. So I appreciate the question, and we have an interagency comms team that includes Natalie, who's moderating, and Jackie. And what I think we should do is bring that question back to the team and say, how can we develop a one-pager or a brochure to put people's minds at ease that this information doesn't go anywhere else? Because a few of you have asked a variation of that question, and I think it's an important one to respond to in a way that families understand.
Okay. Wondering how you see Safe to Help within this framework, someone asks.
I am not familiar with Safe to Help is. Superintendent Sanders, do you know what that is?
Yeah, the Safe to Help is where you can report youth that are at risk of other behavioral issues. So it's we can probably connect those two as well for you. It's through the conjunction with more law enforcement, Illinois State Police, the Safe to Help hotline.
Oh, okay. Okay, so then the question is, how do these things work together?
How you see Safe to Help within this framework, Beacon framework.
Well, just given that little bit of an exchange, it seems that this is possibly another group of people we could train to use Beacon if they're trying to find services for people. And I will say that we're training probation officers, we're training other groups of people who interact with kids who might detect a mental health problem. So I'm open to other suggestions.
Yeah, we can, Dana, you and I can do it on our next check-in. Maybe we can loop in the Illinois State Police and have a conversation.
Yeah.
Okay. We're going to be wrapping up soon. Dana, a number of questions are related to whether or not we will provide access to this webinar and the PowerPoint.
Yes, the webinar and the PowerPoint, this will live on the Children's Behavioral Health Transformation Initiative website, and information about how to access it will be sent, my understanding is, to participants.
That is correct. Another question here. Some families like texting better than phone calls prior to answering a call. Do the people who reach out have the option to text the family? This is especially important for dual language families to have a conversation through Google Translate.
Yeah, I believe they can text the families. I don't think it has to be a phone call. And I appreciate that. I appreciate the reminder that if people are using Google Translate, texting is easier. Let me check in with the team. I think some of them might even be on this webinar today, but let me check in with the team about whether their 3-attempt practice includes text in addition.
All right, and we have a comment from someone whose question you just answered, Dana. Thank you, in all caps. The one-pager would be amazing for families. I'm thinking in particular our communist countries like Russia and China and other Eastern European families tend to have a lot of fear over admitting their child or family has a disability or need, and they're so afraid that the government will find out and do something bad to their family or put them on a list. So thank you.
Yeah, understood.
I think that we have a number of duplicate questions that you've answered. Yes.
I really appreciate everyone's good thinking, and everything you ask and all of your comments and feedback make this better for people and make it a better tool. So I'm really appreciative that everyone, engages in this.
All right, we will wrap up. Thank you everyone for attending. We appreciate you, and look for more information from us with where to find the resources that you've learned about today in an email very soon. Thank you all for joining.